So a little bit about breastcancertrials.org and how we started. So we were actually started by two breast cancer patient advocates who were interested in clinical trials in the late 1990s. And they both had similar experiences where their doctors didn't tell them about trials or didn't know about trials other than those that were at their own hospital that they were being treated. So they attempted to look for them on their own and found it very challenging. One of the women ultimately did find a trial, but she had to call each hospital individually. And so anyway, after they finished treatment, they joined forces and came to UC San Francisco Breast Care Center with this idea to develop a website that would make it easier for patients to find trials on their own. And so the mission of breastcancertrials.org is to empower all people affected by breast cancer to learn about and consider clinical trials as a routine option for care. So currently we have 3 programs that fulfill our mission, all related to clinical trial matching and clinical trial education. Breast Cancer Trial Search is our original program, and it's used for people with DCIS and early stage breast cancer, as well as breast cancer survivors. We have our Metastatic Trial Search that was developed in 2015 based on feedback from the metastatic breast cancer community. They wanted a tool that specifically addressed their unique needs, and it was developed as a collaboration with 5 advocacy groups with the goal of embedding it in each of their websites so that people can look for trials on sites that they are already familiar with and comfortable. And today you can find Metastatic Trial Search on over 40 partner websites. And then we have our third program, which is Metastatic Trial Talk. It's a monthly online newsletter designed to keep people updated on what's new in breast cancer research and learn more about the clinical trial process. There are several other matching tools out there right now, so just wanted to point out how we're different. First, we've been around for a long time, over 16 years, and we're specifically focused on breast cancer, which means that we have expertise in understanding how best to match patients to trials. We're patient-friendly in the sense that we understand that there's a critical need for patients not only to find, but to understand the information. So we manually rewrite all of the trial information in plain, patient-friendly language. We code trials to match to each patient's unique profile in order to provide personalized list of trials. We're also continuously trying to improve our tools based on feedback from patients, advocacy partners, and providers. And we're nonprofit service, which means that we don't sell or share patient data for money or for any other purpose. And we don't accept money from drug companies to highlight their specific trials, which allows us really to provide people with a comprehensive list of trials that's unbiased and equitable. So when people think of clinical trials, they typically think of treatment trials, and these are trials that study new drugs. They also look at ways to improve procedures such as surgery or radiation, but there's also non-treatment trials, and they are aimed to study associations that assess risk factors and understand disease progression or evaluate the impact of certain exposures. And non-treatment trials can include quality of life studies. They can look at side effects, diet and exercise, and things like yoga or acupuncture. And then registries are another type of non-treatment trial. And they're great ways for people to participate in research. They typically involve questionnaires or surveys and may include providing blood or saliva samples. Data collected through these registries are used by researchers to determine what the gaps are and what to focus on in improving treatment and care. And then there are registries that are available for everyone, including people with breast cancer, as well as people without breast cancer. So there are trials for healthy individuals who do not have breast cancer.
Hi, everyone. I'm Susan Colen. I'm the program director for breastcancertrials.org. I have been working on this program for 15 years, and I'm also a 2015 project lead graduate. So I'm really thrilled to be here and share more information about our tools with you today. So over the past 15 years, we've grown and developed and improved our tools, all based on feedback that we get from patients, advocates, and people who use our tool. We started out as one application for all people affected by breast cancer. And today we actually host two programs, Breast Cancer Trial Search for people with early stage breast cancer and post-treatment survivors, and Metastatic Trial Search for people with metastatic or stage 4 breast cancer. Both of those tools are standalone apps and available to be embedded on sites, and they can be found on over 20 of our partner sites today. Okay, so I am going to go through a demonstration of using our tools to find a trial. So when you go to breastcancertrials.org, you'll land on a landing page where you'll have an opportunity to select either breast cancer trial search or metastatic trial search, depending on your personal situation. And for this demo, I'm going to use breast cancer trial search. This is actually our newest program. Metastatic trial search has been around since 2015, and we recently launched a similar version for the early stage breast cancer community. Again, that's standalone and can be embedded on other websites. So both tools are the same. The content is just customized specifically for either early stage or metastatic breast cancer. So I'm going to select breast cancer trial search. Okay. And you can use both of our tools either as a guest, or you can register to create a profile. And there's benefits and features available to registered users that I'll talk about as I go through the demo. But I'm going to start as a guest. We find that most people start as a guest to get an idea of what's inside. And once they land on the trial results page, you can then register from there. You can register from actually anywhere on the site. So to continue as a guest, this page is really just confirming you're in the right place. If you do have metastatic or stage 4 breast cancer, we will guide you to metastatic trial search. If you have not had breast cancer and you're in the healthy or high-risk community, we will share with you a list of trials available for you. But if you were newly diagnosed or in treatment for DCIS or stage 1 to 3 breast cancer, or if you have completed your active treatment, you would click here. And here I'm going to specify for the demo purposes, I'll say stage 2. And all of the questions that we ask are related specifically to eligibility criteria with the goal of filtering the trials in a personalized way. So it might help to have a pathology report or your health records available to answer some of these questions, but you can always skip at any time. You can leave the question blank. You can ask your doctor and come back to the tool. But the most important biomarkers here are markers that we ask for, again, for filtering the trials appropriately, is ER, PR, and HER2. So for the sake of this demo, let's say the tumor is triple negative, and perhaps I don't know information about these other biomarkers, so I can leave them as unsure. And here we are, most breast cancers, or majority, are ductal, but if you have lobular breast cancer, you can select that here. If you have selected stage 3 breast cancer, or if you're using metastatic trial search, there will be an option as well for inflammatory breast cancer, and it would be important to select that if that was appropriate for you. And here I'm going to enter the date of diagnosis. And again, for the sake of the demo, let's say this is a stage 2 triple negative breast cancer that was recently or just diagnosed. So I'll say July 2024. I'm going to select female postmenopausal. And then here, it's very important to enter your zip code because trials will then be sorted by distance from the zip code that you enter. So I'm going to put in a local zip code for me. It's also important to answer these other demographic questions, but I will skip them for the sake of this demo. And these are the questions as a guest that we ask you and that we match based on. So you could see that we've matched 206 trials. That's a lot. We have over 800 trials in our registry, so we've narrowed it down to 206. But one of the best ways to further narrow your results is to register and create a profile. Because on the profile, we have additional questions about your treatment history. And many eligibility is based on whether you've already had treatment or not, and if you've had treatment, what type of treatment you've had. So as a guest, though, there are still ways to narrow this down, and you can start by looking at trials that are close to you. So my zip code pre-populated here, but I could change it if I wanted to look at other parts of the country. But let's say I wanted to see trials that were 100 miles from my zip code only. I can apply the filter here. And then we will go from 206 to 29 trials in my area for stage 2 triple negative breast cancer. And again, these are showing trials regardless of your treatment history. There's other ways to filter. You can filter by the type of trial. And here we list all the types of trials that we list or that we show on our website. And we categorize them by treatment and non-treatment trials, which Sabrina talked about earlier. We have a category for surveys, interviews, and registries, and that's where you would find the wisdom study here. And then these categories are also customized for based on which app you're using. So if you're on metastatic trial search, you would only see categories that are relevant to that population. So if you're newly diagnosed, you can potentially just select treatment trials if you are interested in looking at treatment options and not want to necessarily navigate through the non-treatment trials at that time. Or, people call and ask, are there immunotherapy trials for us? Say, if you're interested in a certain type of trial, you can click that here. So let's look at vaccine and immunotherapy trials for our profile. And then we will go from 29 to 6 trials in my 6 immunotherapy trials in my area. And you might also want to remove the location filter and see, what are the immunotherapy trials that exist across the US in general. And maybe I can or have the ability to travel. Okay, so now we're ready to look at and review our trial results. For each trial, our trial information is actually, the source is clinicaltrials.gov. So we list all of the trials in the US that are currently recruiting for breast cancer patients. But we rewrite the information in plain language or patient-friendly language, and including the titles. So we have an opportunity to show the scientific titles, but we have found that this can actually be a barrier to people. It's if they don't understand the title of the trial, they might not be apt to continue looking for information. So we have this for people who might be interested in the scientific titles, but by default, we show our rewritten trials. We have a high-level summary for each trial that talks about the purpose in a very general way. And we also have this description of eligibility, because if you're using the tool as a guest and you haven't entered treatment history, you can more easily identify trials where you would be eligible. So for example, this trial is for someone who has not yet received treatment, whereas this trial requires that you have received neoadjuvant or treatment before surgery with a certain type of chemotherapy, etc. So you can more easily browse through these trials to identify ones that you might be interested in. We also show the distance from your zip code, the nearest location, an estimate of how many visits would be required. We link to the clinicaltrials.gov listing for each trial and also show the phase. If you clicked full trial details, you would also see a high-level description of the treatment plan or what would be involved if you participated in that study. We have some patient-friendly information, further information about the drugs or procedures that are being used in the study. And then we also link to external sites that might help people get more context or more information about this, what's being studied in this trial. And we'll also link to sponsor websites if there is one. And then we show at the bottom for each trial options for taking action if you were interested in that trial. So you can share this information with your provider or anybody by sending an email from the site. You can customize these fields, and the email will include a link to the trial information on our website. You can download a PDF and bring that with you to your doctor, or you can copy the link and send the information by text or through your own email service. You can also view all of the locations where this study is being conducted, and will provide contact information, phone or email, whatever is available, so that you can contact the research site directly if you have any questions about the study. And you can also print the information, again, to bring it with you to an appointment. And you can also save trials as favorites. This feature is only available if you are a registered user and you're logged in, and then you would be able to save your trials and view them here. Another benefit of creating a profile and saving and registering is that you can sign up for trial alerts, which means that we would send an email every time we list or add a new trial that matches to your profile. And other benefits for saving your information is that if you come back to look for new trials, you don't have to re-enter your information. And it also makes it easier to update your information at each um, um, point in if there's been any changes in your diagnosis or in your treatment. So for the sake of time here, I'm going to stop here. And I just, want to reiterate that our goal is to make it easier for people to learn about and find trials. And we know there's a lot of information on the site. There's a lot of information about clinical trials in general. You can always call or email our help desk by clicking here. And you can also schedule a free appointment with Sabrina, our clinical trial navigator, for a personal one-on-one session for additional information for using the website and finding trials.